Hello, I'm Monica Smith. I'm a physical therapist here at Avista Adventist Hospital, and I'm here to talk to you about how you can get ready for your spine surgery coming up. By far, the more prepared you are, the stronger you are before you have surgery, the better your recovery is going to be afterwards. So first, we're going to go through the exercises that are in your spine booklet. Hopefully you have that booklet with you. These exercises are on page 21. So these exercises are the same exercises you're going to be doing after surgery as well. So we want to make sure you're familiar with these exercises before you have surgery, because after surgery, your brain and your body just don't talk to each other nearly as well as they do now before surgery. So we want you to be familiar with them before you have surgery. Plus, they can be very good core exercises without too much stress or strain on your body. Yet really working towards some good strengthening before you have your surgery. So the first exercise you're going to do is an abdominal contraction. So you'll see in your booklet, Jeremy is seated in a good upright chair, good back support, and his hand is here on his stomach muscles, because those are the muscles that we want you to engage. All of these muscles here mesh into your spine muscles. So we want all of that to be good and supportive before surgery, and it's going to help after surgery as well. So you're just going to pull in those abdominal muscles, kind of like you're trying to put on a too tight pair of jeans. So you're going to suck in those abdominal muscles, hold it for just a couple counts, and then relax. You're going to do that 5 times. The next exercise is shoulder rolls. The picture shows Jeremy seated in a chair. It really can be wherever you're at, seated or standing. And it's going to be just like the arrow is showing. So you're going to want to make sure that you're doing good shoulder rolls backwards. This is going to engage those back muscles in a gentle way. And it's also getting you out of this forward flexed position. Whenever we're in pain, mentally or physically, we tend to curve in. Plus, the majority of our activities are always in front of us as well. So it's good to get those shoulders back. I want you to imagine that you're tucking your shoulder blades into your back pockets. So that's the motion you're going to do. Squeeze those shoulder blades down and in. And you're going to do 5 of those as well. All right, your next exercise that you're going to do is called a lower leg raise. Again, we want you in a chair with some good back support. We want you nice and tall and upright, good upright posture. And all you're going to do is you're going to lift and slowly lower those legs. This is strengthening that good quadricep muscle. You're going to get a little bit of a stretch along those hamstrings. You're also going to get a little bit of a neural glide. So those nerves that are back here in your back that you're having surgery on, they go all the way down into your legs. So just by lifting and lowering, you get a lot of benefit. All right, nice and slow and controlled. Your next exercise is an ankle pump. This really can be done wherever you're at, seated or in a recliner, on a bed, on a couch. Really no wrong way to do this exercise. And you're just wiggling those feet up and down, pointing and flexing those toes. This is going to help prevent blood clots in those legs. Sometimes can be a complication after surgery, and this is a great easy way to prevent that. Your next exercise is a heel slide. This one needs to be done on something where you're laying flat. So on a couch, in your bed. In the booklet, it shows our model with a blue belt around her leg. Before and after spine surgery, you don't need that blue belt. All you're doing is you're sliding your heel. That's why it's called a heel slide. When you bend your hip, you're going to feel your lower back press down into the bed. So you're getting a little good motion back here, a gentle stretch. And that's what this exercise is for. If any of you have need a chest stretch, that's what this exercise is. It's just in a much more gentle position, which is what we want before and after surgery. So you're just sliding your heel, bending up that knee and that hip, until you feel that pelvis, your lower back, press down into the bed or the couch, whatever you're at. All right? Your last exercise that we're going to talk about now is only going to be performed before you have surgery. It is by far one of my most favorite exercises for head to toe strengthening without any special equipment needed whatsoever. So it is, in the book, just called a push-up. It also can be called a sit to stand. All of those work. So you're going to try to find a chair with arms, and you want this chair to be sturdy. There's going to be two methods to this exercise. In the booklet, it's only going to show this first method. So what you're going to do is you're going to put your hands here on the chair. You're going to use your legs minimally, and it's going to be much more for upper body strengthening. So hands on the chair, you're going to lean forward a little bit and push yourself up out of the chair and slowly lower back down. So I'm getting a lot of good chest and arm strengthening with this one. All right, it's a chair push-up. That's what this one is going on. The next part of this exercise that's not really explained in the booklet is really going to be strengthening from your waist down to your feet. So you're going to use those arms as little as possible, none at all if you can. If you need those arms, just try to have your legs do the majority of the work and then arms kick in when you need it. So this next part, you're going to lean forward again, push through your feet and your legs, and slowly stand up, and then lower back down. And you're going to do that 5 times. So hopefully you're feeling it in your legs, your butt, really pushing your butt back into that chair so we don't get any stress on the front of the knees. So as you can feel, that's going to strengthen the upper body with that first method, and the lower body with basically a squat into the chair. All right, great head to toe strengthening with all you need is a chair with arms on that one. You're only going to do that exercise before surgery. That exercise is so important before surgery because we want you strong, head to toe. If you are having neck surgery, cervical spine surgery, then the exercises that you're going to do are on page 24 of the spine booklet. The exercises that are on the previous pages are great general strengthening exercises as well, but these are most beneficial for neck surgery. So you can see they're all isometric neck exercises, they're called, but these aren't going to be big, strong holds. You're going to take 2 fingertips worth of pressure, and you're going to start by putting them on the front of your head, and you're going to just press forward into those fingertips. All right? You're just going to hold for a second or 2, and you're going to do 5 of those. The next one you're going to do, you're going to take those 2 fingertips worth of pressure, put it on the side, and you're going to press straight sideways, pretending that you're trying to have your ear touch your shoulder, but your fingertips are stopping you. All right, so that's your side bend. The next one you're going to do, move your fingertips forward just a little bit onto your temple, and you're going to push on your temple on either side, like you're stopping rotation of your neck. So I'm trying to rotate into those fingertips. And then the last of your isometric exercises, take those 2 fingertips, put them on the back of your head, trying to press the back of your head like you're going to try to look up towards the ceiling. So you're getting the 4 major motions with these isometrics, but you're not moving. So again, it's only 2 fingertips worth of pressure. You're not taking your whole hand. You are not pressing maximally. You're just pressing enough that those muscles of your neck remember how to support your head and how to stay engaged so that when you're recovering from this surgery, everything stays nice and strong. Another one of the exercises from the other group of spine exercises are the shoulder rolls. I really think shoulder rolls are very important as well for the neck, for the cervical spine patients, people having surgery on the neck, because sometimes after a neck surgery, you can start to shrug up these muscles are going to start to try to guard. By doing those shoulder rolls, you're reminding your body, nope, shoulders stay down and relaxed. I don't need to be tense and tight, all right? So those shoulder rolls can be very beneficial for low back and for neck surgeries as well, all right? Those are your exercises. We want you to do those every day before surgery, and then be as strong as you can. If you already are riding your bike, going for walks, whatever exercise you're able to do right now, keep doing that. If any type of exercise is difficult for you, just try to stay as active as possible and then go through these exercises in your book. All right. I also want to talk about spine precautions. Those are in your booklet as well. Those are starting on page 15 in your booklet. So we want you to start building these habits now because we want them to be ingrained. We want you to be moving like this naturally after you have surgery. So you have 3 precautions that we don't want you to do after surgery. It's going to make sure you heal well from your surgery with fewer complications. So your main 3 precautions we want you to remember. We remember them by saying no BLTs. That means no bending, no lifting, no twisting of the body part that you're going to have surgery on. So if it's your low back, we don't want you bending at your low back. You can bend at the hips though. So by pulling in those good strong stomach muscles, keeping my back flat, I can still bend over. I'm just bending at the hips. I'm not bending at the spine. You cannot bend at the spine, but you can bend at other body parts. You can do the golfer's lunge if you need to pick something up from the ground. You can squat, good strong stomach muscles, and squat. Sometimes those can be difficult to do, so we would recommend getting a reacher grabber. Those do not cost very much money. You can get those on Amazon or any online, or a lot of stores carry those as well. So no bending of the body part. If you're having neck surgery, we don't want you bending at the neck. No lifting. So that means you're going to want to keep everything between shoulder height and mid-thigh height. No lifting anything up and overhead. No carrying heavy items. When you do go to carry anything, we want it initially less than 5 to 10 pounds. And when you carry something, we want you to keep it close to your body and in the center. If you have a big, heavy backpack, I do not want that just slung over one of your shoulders. You're going to want it on both your shoulders, or a cross-body bag. After surgery and after you've recovered, if you're carrying groceries, we really want you carrying something of equal weight in both hands. That's going to make sure that you're not pulling yourself off one side or the other. So no lifting, 5 to 10 pounds. I want you to take a look around your home. Things that you use often, try to move to counter height temporarily so that you're not reaching way overhead, you're not bending way down below. Move things temporarily counter height. It's going to make things a lot easier after surgery and help you maintain those precautions. So your last one of the 3 precautions that we want you to follow is probably the hardest. It's no twisting. So no twisting of the spine. That's going to really make sure that your surgery holds well and secure. All those good little vertebrae hold steady. So no twisting at the spine. You can't do this. If you need to reach for something next to you, it needs to be that your feet turn to reach for something. All right, try to imagine that your shoulders and your hips are like a log. They're all in alignment and they do not twist. We do not want you twisting after surgery. These 3 items are habits we want you to start building now. They will make sure you recover well from your surgery afterwards. So getting in and out of bed after you've had spine surgery, and really this is how we all should be getting in and out of bed. It's just good for spine health. But this is going to make sure when you get in and out of bed that you do not twist your spine. So you're going to do a log roll. This is in the same page of your booklet that the spine precautions are on. you're going to go down onto your shoulder and your feet are going to come up. Then when you roll onto your back, you're going to make sure that your shoulder and your hips stay in alignment. You're not going to twist that spine. All right, so that's getting into bed. Getting out of bed, bend those knees. That allows my good strong leg muscles to help me. You're going to roll onto your side, not twisting your spine. You are then going to use your hands on the bed and you're going to drop those feet off the edge because that's going to allow my legs to help pull me up into a seated position without twisting, without bending. It might feel precarious. It might feel not very comfortable, but it's a lot safer way, and it really will be a lot less painful after surgery. And again, a great habit to start building now. Then to have the first time you try this be right after surgery, that's going to really make you feel uncomfortable. So start practicing this now. And really, this is how we all should be getting in and out of bed, whether we are having spine surgery or not. So it's a great habit. Please read through the rest of your booklet. It has lots of great information and may answer questions that you have. It talks about how to get in and out of a car without twisting, and there's pictures in there. It shows how to get in and out of a tub. Lots of great information. There's also a page on nutrition advice and how to heal well after surgery. So again, read through your booklet. There's a lot of information in there. I look forward to seeing you after your surgery and helping in your recovery. Good luck.